So I'm Jim Baugh. I'm the Executive Director of Disability Rights Idaho. We're a private nonprofit corporation. We provide advocacy and legal services for people with disabilities. We also employ a lot of people who have disabilities, and we employ people who have family members with chronic health conditions. Our insurance premiums for our group health plan were skyrocketing with the cost of health care. But because we employ so many people who have high costs and high claims, our premiums were considerably higher than most comparable small businesses until the passage of the Affordable Care Act. After that, they required that the premiums be based on factors other than your claims history, like your location and whether you smoke and what your age is. So when that happened, our premiums dramatically dropped. So with an agency like ours, which at the time employed about 16 people, we saved $120,000 per year in premiums because we no longer had to pay the punitive premiums that insurance companies charged us because of the fact that we employed so many people with health conditions. So that's been a major benefit for us, obviously. That extra $120,000 a year went to give raises to our current employees and allowed us to start hiring for positions that we had been cutting back and laying off over the years as the cost of health insurance premiums went up. One of the groups of people that we serve as Disability Rights Idaho are people who have serious and chronic mental illnesses. In Idaho, you would think that people in that condition would mostly be qualified for Medicaid. But as it turns out, for various reasons, Medicaid only covers about 45% of the people with serious, chronic, persistent mental illness. The rest of them live mostly in the insurance gap. That is the area between 100% of poverty and 138% of poverty. So they receive no coverage for their mental health treatment, and they get whatever treatment they get through the state's Department of Health and Welfare. Those services are available to people only after they've entered a mental health crisis and have posed a threat of harm to themselves or other people. And for that reason, we basically don't give them any supportive care, we don't give them any preventive care, we don't give them any treatment, and we frequently don't give them a way to have access to medications and other things that they need to avoid the mental health crisis. So we are strongly in favor of expanding Medicaid, in part to cover those people who have chronic and persistent mental illness. In addition to that group of people, there are a lot of people who have met the eligibility criteria for disability under the Social Security Act, which means that they've been found to have impairments and health problems that are too severe for them to be able to work and to engage in what they call substantial gainful activity. But they're not allowed to get coverage under Medicare for 2 years after that determination's been made. So these people lose the coverage they may have had under their employer, they lose their ability to continue to make a living, and they have to wait 2 years before they have health coverage. We support Medicaid expansion to cover those people with disabilities who have no way to get coverage under our current system.